Medial collateral ligament injuries, or MCL injuries, are common in cutting, pivoting and jumping sports, but thankfully most of these have a very good recovery. The medial collateral ligament complex of the knee is a thick, broad band of fibrous tissue that reinforces the inside of the knee. It has a superficial and deeper layers. The superficial layers resist valgus forces where the foot is pulled out to the side or when the knee falls in. They are further from the centre of rotation, and that's why they do this job well. The deeper layers resist rotational forces that tend to turn the foot out. You can see here the mechanism for MCL injuries for the superficial layer and the deeper layer. After this sort of injury, a patient will usually have significant swelling and pain on the inner side of the knee. The joint will open up on clinical testing because the ligament is not performing its usual function, and it may feel unstable to the patient to walk. We grade the injury from 1 to 3, where grade 1 is a small partial tear, and grade 3 is a complete rupture of the ligament, and grade 2 is obviously somewhere between. Sometimes it can be associated with ACL injuries or a dislocated kneecap or patella, as the knee is pushed out of its normal alignment during injury. Even a grade 3 injury can have a full recovery with appropriate treatment, but in some cases the end of the ligament can get stuck under the hamstring tendons, which stops it reattaching and healing. The management of MCL injuries. Isolated MCL injuries should be treated using relative rest, ice compression and elevation. Optimal loading is very important in stimulating the healing of the torn fibres whilst protecting and allowing those torn fibres to meet. In most cases, a range of motion brace is worn with as much weight bearing as can be tolerated, with gradual reduction in the restriction of range during about a 4 to 8 week period of recovery. In most cases, strengthening exercises and even cycling can be done in the brace as soon as this is comfortable. Having a knowledgeable clinician monitoring and providing adjunctive treatment during the healing of this ligament complex can maximise its stiffness and accelerate recovery and return to function. There's often residual laxity of the ligament even after full functional recovery, so it's critical to maximise knee strength and stability as well as the sense of joint position, or what we call proprioception, prior to and after return to play for ongoing prevention.